with is going to be Leishmania. First tell me, bet the cat can't keep up on the lap. So lap matlab Leishmania mein what are the two forms that I will be having? Amastigot, promastigot. Please remember, out of them, promastigot is like pro. That is what is going to take the initiative and cause the disease. So promastigot is pro, that is the one that is going to be the infective form, whereas amastigot then becomes the diagnostic form. Because I know all of you, as soon as I said Leishmania na, you guys have assumed I'm talking about Leishmania donoveni. Okay, abhi ke liye I have many other Leishmania, but abhi I'll say Leishmania donoveni. And you all study that there is something called LD bodies in Leishmania donoveni that you see. So you know what is LD bodies? Who sees LD bodies? Someone with a microscope, matlab pathologist or microbiologist. That is a person who's going to look at it under the microscope. And LD bodies, when you look under the microscope, they are nothing but amastigot form. So analysis जो हम करते हैं LD bodies, that is the amastigot form that we see with Leishmania donoveni. What is going to be the vector? The vector over here is going to be the sand fly, and I think this I don't need to make any mnemonic. The disease that I'm talking about in Kala Azar. So India, especially Bihar, these are the places where you see a lot of cases of Kala Azar. So now guys, tell me one thing very quickly over here. The three organisms that I have taught you right now is Trypanosoma cruzi. Then I've taught you that sleeping sickness wala Trypanosoma brucei. And now I'm teaching you the Kala Azar one, that is Leishmania. Can you quickly revise their vectors with me? Ek table bana lo jaldi se. Tell me for Trypanosoma cruzi, you said ma'am cruise mein kissing, so kissing bug. Triatomine bug is how you had, triatomine reduvate bug, how you had learnt it. Trypanosoma brucei, sleeping sickness, so CC fly is how we had learnt it. And now the only one that is left is sand fly, and that is going to be in Leishmania, Kala Azar. Simple. So now talking about Leishmania means I'm only going to have two forms, amastigot form, promastigot form. So the life cycle becomes so simple. I know you will have problems in reading it, so I will quickly write it for you once again. So first and foremost, the hint in the paper will be that there will be a sand fly that will be drawn over here, and I will have a human being that will be drawn over here. So human being and sand fly matlab Leishmania is definitely coming to my mind. And then I will see which is the infective form, who will do the disease, promastigot. So they will always mention that it is the promastigot that has gone inside, that is the infective form, promastigot. After going inside, what will it change into your body? It will form amastigot, matlab wo LD bodies banega, amastigot. And after the amastigot, I will see that this is then finally going to be taken up by the sandfly again. So sandfly will take it up, sandfly will then convert the amastigot form into promastigot form, and the promastigot form will be given back to me. So basically what I take into us, the pro form is infective and the amastigot form is gonna go away. Simple. These are the only two forms. Itna complicate karna hi nahi hai. You just have to know, I will see a sandfly and human being wala life cycle. The pro is the pro form that is going to cause infection to me, and how I'm going to do the diagnosis is going to be via the amastigot form. Now what is the disease that I'm talking about? We're talking about Kala Azar. The recent FMG exam question also this was. And Kala Azar matlab, the reason why it's called Kala is because there is a pigmentation of the skin that you can very well see over here. There is a dark, blackened, scaly kind of a skin. So Kala word actually comes from that. Apart from that, you will see, so first and foremost I'll write the word Kala because that tells me dark, ashen, pigmented skin. You will also see a protuberant abdomen because these patients come to you with hepatosplenomegaly. And let me tell you, there is massive spleen that is defined in these patients. There is massive splenomegaly that you're going to see in these patients, right? These patients have hepatosplenomegaly. Apart from that, there are symptoms of any infection. There are fever, there is weight loss, there is weakness, night sweat. So these are, common symptoms of every infection, but the two main things are the pigmentation and the protuberant abdomen. However, there is one rare variety. And what is that rare variety? If the patient is HIV positive and the patient ends up having Kala Azar, we have seen that many a times that hepatosplenomegaly is not seen. This is an atypical presentation that you can see, that if it's HIV positive patient with Kala Azar, you might not see the protuberant abdomen. Now, this is the patient of Kala Azar in front of you. Of course, with this, you will obviously want to tell me that, ma'am, diagnosis bana do, treatment kara do. Simple as that. So, how are you going to do the diagnosis over here? Please note that for the diagnosis, first question that will come to everyone's mind is sample kya lenge. So, the sample, of course, is the very, very famous spleen. This question has come a million times in the exam. There's a long list. Okay? So they ask you in terms of sensitivity, which is the best sample that you should be taking. I should be taking an aspiration from the spleen. But do you think two very common problems that I can see? Spleen, firstly, the spleen is huge at this point of time. It's a case of Kala Azar, massive splenomegaly ho rakha hai. Secondly, spleen is an extremely vascular organ. So it can be quite disturbing because it's very vascular. It can result in a lot of bleeding. So spleen hai to best, but what is the most preferred will be a bone marrow. After that, you have a lot of other samples, like for example, you have the blood. You can even do a bronchoalveolar lavage if you have an HIV positive person, because HIV positive person, I was telling you, spleen and liver are not very commonly involved. So you might get to see it in the lungs. HIV mein to disseminated infection is noted. So yeah, these are the samples, but the question, let me tell you the question beforehand. The most sensitive sample of Leishmania that you're going to get is going to be from the spleen. After you get it, or whether you got it from the spleen or the bone marrow, what will you see? You'll say, ma'am, pro-mastigot to infection kara raha tha. Diagnosis ke liye I need A-mastigot form. So, if I ask you out of these two, which is A-mastigot and which is pro-mastigot, so you'll say very simple. The first point of this chapter that you told us was that A-mastigot form is gonna have absent flagella, and I do not see any flagella coming out of it. I don't see any flagella coming out. Yahan par stop ho gaya. So this is one thing. Next, you told us that there will be a nucleus, and then you told us there will be a chota sa dot, which is a kinetoplast. That is how I will identify. This is, guys, what is known as an LD body. The other form jisme flagella dikh raha hai, that must be the pro-mastigot. I am not much interested in pro-mastigot. My diagnosis does not depend on pro-mastigot. My diagnosis depends on these LD bodies, A-mastigot. And you know how are we going to see them? Please remember the LD bodies. This is another previous year question. LD bodies, which I am calling as the A-mastigot form, they are not just lying everywhere, they are eaten up. Remember this line very, very well. They are eaten up or engulfed by the macrophages. So examiner is very smart. He will not write macrophages. He will write the complicated aspect of macrophages, that is reticuloendothelial cells. Reticuloendothelial cells. So he will ask you which is the parasite which goes into the reticuloendothelial cells of the system. Matlab macrophage. Macrophage matlab wahi hepatosplenomegaly wale macrophages. So LD bodies or A-mastigot. So what you see over here, this one big cell over here is a macrophage, and this another big cell over here is also a macrophage. And what do you see? If I can zoom in, I've got you zoomed in pictures. You see organism na? And dekho, organism has two dot, big dot, small dot, big dot, small dot. Why big dot, small dot? The big dot is going to be the nucleus, and the chota wala dot will be the kinetoplast. Look over here again. The big dot is the nucleus and the chota dot is kinetoplast. Again over here, big dot is the nucleus and the chota dot is the kinetoplast. So please remember LD bodies. This is very, very important. This picture, this sentence, LD bodies is A-mastigot form. LD bodies is going to be seen in the macrophage. And reference skill, I've got you this one. Will you call this form A-mastigot or pro-mastigot? You'll say, ma'am, there's a beautiful flagella coming out. I will have to call it pro-mastigot form. Simple for everyone. You've done the diagnosis by looking at it, but the story is not over. You're also going to do some blood tests, some miscellaneous tests. So please note, these patients can come across as pancytopenia. Tabhi to I was saying you can do bone marrow. Now correlate. There will be a patient, I'll tell you an entire history. There will be a patient who has come to you with dark skin, who's come to you with fever and all those fever wale symptoms, night sweats, weight loss, with a protuberant abdomen. Ultrasound is showing you massive splenomegaly. Apart from that, you are also seeing that this patient is, spleen to puncture kar nahi sakte. So you said that first let me do a blood test. In that blood test, you found that this patient has pancytopenia. You'll be like, okay, something is problematic in the bone marrow. So should I be going ahead and doing the bone marrow analysis? Of course, spleen I can't puncture. It's very, very bloody, vascular. So I'll go for the bone marrow. And what will I see in the bone marrow? I will start seeing that the macrophages are showing me LD bodies. That is an entire story of a patient that I've told you. Okay, so this is one thing. What other blood tests can you do? They tend to show you a lot of gamma globulins. Hyper gamma globulinemia is seen, and there are ANA test for it. Gamma globulin matlab antibodies na, in simple words. So antibodies ke liye aldehyde and antimony test. Antibodies के लिए what we have studied is going to be the aldehyde and antimony test, that is Napier's aldehyde and Chopra's antimony test. ठीक है, साइंटिस्ट का नाम भी important है. तो antibodies बढ़ा है, how will I get to know? By the aldehyde test. Although nowadays we do all of ELISA and all, these are only for MCQs. Coming to the media, that I've already told you, Leishmania is by the triple N media. And the last thing is definitely going to be the PCR, because you know PCR तो हर जगह का gold standard है ही है. There is no doubt about it. One more thing, guys, I want all of you to know, go back to your immunology chapter. In immunology chapter, I told you all the skin tests come, no one does this test now, but immuno ke liye important hai. All the skin tests come under type 4 hypersensitivity. I'll remind you. Do you remember what was the skin test for TB? Montu's test. What is the skin test for leprosy? Lepramin test. So what is the skin test for Leishmania? It is the very, very famous Montenegro test. It is the very, very famous Montenegro test. So please note that the Montenegro test is gonna be a skin test, which is that all skin tests are type 4 hypersensitivity. It's a skin test for Kala Azar that we must be knowing. Right? Now coming back, you've done the full diagnosis. This patient has actively been diagnosed. So now comes the time of his treatment. So what is the drug of choice? The drug of choice is going to be LAMP, that is liposomal amphotericin B. The drug of choice is going to be liposomal amphotericin B, which is very, very important. Now, for example, you have treated this patient. You have treated this patient with liposomal amphotericin B, and after 1 to 2 years of treatment, so after the post-Kala Azar, he comes to you with these hypopigmented nodules. You gave him liposomal amphotericin B after 1 to 2 years of treatment. He's come to you with dermal leishmaniasis. How are they identified? Hypopigmented nodules. Now what will you treat him with? You will treat him with oral miltefosine. It's an oral drug that you give. Oral miltefosine is how you're going to treat him. So simple. First you gave him liposomal amphotericin B. Treat ho gaya, very good. Nahi treat hua, he can come to you 2 years later with post Kala Azar dermal leishmaniasis PKDL, and then you will treat him with what? You will treat him with oral miltefosine. So this is after Kala Azar, but that is now Leishmania ho gaya, Kala Azar ho gaya. But that is giving me a little bit of worry that without all of this, can there be some Leishmanias that affect the skin only? Is there something known as cutaneous leishmaniasis? Yes. And that is not Leishmania donovani, that is Leishmania tropica. So that you can very well see is causing a cutaneous problem, and that was now a recent NEET PG 2023 question. And that is, what is cutaneous leishmaniasis? That is going, you can see, na, there's a very reddish color border. You can describe it. I don't need to write it also, guys. You can describe it on your own. There is an erythematous border. There is an erythematous border, and in the center of that border, you can see a lot of exudate, or you can see a lot of discharge that is present, a yellowish color discharge that is present. That is known as lots of fancy names given. Firstly, we'll call it as per maybe some sites or some places. So Oriental sites, Oriental Sore, Delhi boil, Baghdad boil, these are one names. It is also known as the Chiclero ulcer or the Aleppo button. So I have not made any mnemonic because the jitne bhi fancy naam hai, they are coming under this ulcer. Remember Chiclero ulcer, Aleppo button, and in terms of places, Oriental Sore, Delhi boil, Baghdad boil, all of them are by tropical. Tropical matlab tropical, subtropical countries na, to aise I have learned. All tropica is causing all these places wala thing. Baghdad, Delhi, Oriental Sore. So that is L tropica. What is gonna be the treatment? I think this you know from pharmacology. Sodium stibogluconate is the treatment that you have. SSG hai na. Sodium stibogluconate is gonna be the treatment for cutaneous. There's one more thing that I want to tell you. Cutaneous to pad liya. Now I want all of you to go ahead and talk about mucocutaneous leishmaniasis. Mucocutaneous leishmaniasis is caused by what? It is caused by Braziliensis. So again I have learned Brazil, B for buccal. So sirf cutaneous nahi hoga. So when you write Braziliensis, when you write Braziliensis, you will learn that it is definitely to do with the skin that is cutaneous. It is definitely to do with buccal also. So this causes mucocutaneous leishmaniasis, and that is also known as espundia. That is known as espundia. You can see these lesions which are present not only on the buccal mucosa, on the skin. So that is what is caused by Braziliensis. Treatment iska bhi wahi, sodium stibogluconate is the treatment. So please revise with me. What all you studied for Kala Azar was Leishmania, Donovani, LD bodies. We know know that. Now what I'm going to tell you is going to be the cutaneous ones. तो सिर्फ cutaneous पूछा है तो that tropical thing they have asked you, oriental as per places, Aleppo button, Delhi boil, Baghdad boil. So that is only cutaneous treatment, sodium stibogluconate. But if they say that there is mucocutaneous, buccal and skin is caused by Leishmania brasiliensis, treatment again the same, that is sodium stibogluconate. Last thing, I want to ask you, what is Leishmaniasis recidivans? If you read the word recidivans, it is sounding like relapsing. Matlab you gave the treatment, but there was some problem in the treatment. You gave the treatment, liposomal amphotericin B diya tha, but now it has relapsed. So nothing but a relapsing Leishmaniasis. So instead of relapsing, they've called it Leishmaniasis recidivans. And what will you see with it? You will see that center mein to there is clearing. Means this part of the lesion has undergone healing. But if you will see the periphery of the lesion, there are nodular parts over here. There are nodular lesions which are gonna be present. There are nodular lesions that are present around a central healing. एक और photo देखो, beautiful picture. You can very well see that there is a central healed portion and you can see these nodular lesions that are present on the side. This is known as Leishmania recidivans, मतलब relapse होना, inadequate treatment की वजह से. On that note, we have finished all of our hemoflagellae and we are ready to do some MCQs out here. So first one that you have to pick up is this. Trypanosoma cruzi initially penetrated through the mucosa and multiplies in a lesion called shagoma. Okay, my mnemonic is coming into my place. In the chronic stage of the disease, what are the main lesions often observed? Yeah, it's chronic. Remember in Chagas disease, we were doing that cruise life. बड़े लोग बड़ी बातें, all organs were becoming big. I told you that the heart will show you dilated cardiomyopathy. Then you will see mega esophagus, you will see mega colon. तो मतलब heart and GIT were the two organs in the chronic condition which I was telling you were becoming bigger, and that is what you have in front of you. Picking up the next question. So many times I have taught you this question and I hope you don't get it wrong. NNN medium is used for the isolation of. Don't read anything. Tell me your answer first. NNN medium was for Trypanosoma cruzi and it was for Leishmania. Only member of this entire chapter which is not going to grow is Trypanosoma brucei, because I told you sleeping sickness. Man will be sleeping. So sleeping sickness के लिए Weinmann medium होगा, right? तो यहाँ पे I had to pick up Trypanosoma cruzi and I had to pick up Leishmania donovini 1 and 4 and that becomes my answer. So when you get these kind of multiple options, na, think of your answer first and then start searching for it. Let's pick up one more question out here. Very simple. Romana's sign, going to Rome. Best life, Jhakas life. Remember, Romana's sign was Jhakas life. That was Chagas disease. Trypanosoma cruzi causing Chagas disease, showing you Romana's sign. What was Romana's sign? It was periorbital. It was periorbital edema. Very good. One last question that we are going to take up is this. In Chagas disease, which stage is found in the muscle tissue? Again asking you, Chagas disease matlab, now first you will put up, okay ma'am, in Chagas disease, I will remember my mnemonic. Bet the cat cannot sit on the lap. Bet the cat cannot sit on the lap. तो हमें basically focus करना है cruzi पे. It has amastigot, trypomastigot, एपीमास्टिगॉट. बट एपीमास्टिगॉट तो इंसेक्ट में होता है, हमारे में होता ही नहीं है. तो एपीमास्टिगॉट चला गया. नाउ माय एपीमास्टिगॉट इज गॉन. इट हैज ओनली ATNE. प्रोमास्टिगॉट तो इट डजंट हैव ओनली. So these two options are gone. My only confusion is between amastigot and trypomastigot. If you guys remember carefully, trypomastigot was the form that was coming and going, tat, 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 tat. So the one that I would see in the muscle tissue will definitely be the amastigot form. Two more questions which are like one liner wale. What is CC fly? So again, CC fly matlab sleeping sickness, and I have option number 4. This was also a PYQ that we have. तो बहुत जल्दी हो गया. Trypanosoma brucei, CC fly, sleeping sickness. And one last question. Winter bottom sign is seen in. So first and foremost, winter bottom sign was seen in African trypanosomiasis. There is no doubt about it. But students get confused between East African or West African. So W for W. Winter bottom sign is going to be seen in West African sleeping sickness. It is seen in West African sleeping sickness. So please remember, what was winter bottom sign? Can you recall that? So I hope there is no confusion. That is what I want to sort out this last thing on. Winter bottom sign was seen in that West African matlab posterior cervical lymph node is how we were noticing it. Posterior cervical lymph node in West African sleeping sickness. So those signs hai. I want to wrap up this table on 2 signs. West African sleeping sickness shows you the winter bottom sign, and then there was a Romanas sign. Romanas sign, which is periorbital edema, that was seen where? Going to Rome, cruisy wala. So cruisy is gonna show you the Romanas sign. Okay, don't get confused between Romanas and winter bottom. Two very, very important signs that you have to know in this chapter. On that note, we have